Hello and welcome to the GI Nutrition Show. I'm Amy McCrea, registered dietitian and CEO of Grounded Root Nutrition. Today's topic is food sensitivity testing. So before we get started, let's first clarify the difference between a food intolerance versus a food allergy versus a food sensitivity, because there's a very big difference, and if we don't understand those to begin with, then the rest of this episode isn't going to make any sense whatsoever. So a food intolerance does not involve your immune system at all. So if somebody says to you, I'm lactose intolerant, that means that their body doesn't make the enzymes to process and digest that lactose. So it's not an allergy, it's not a sensitivity, it's truly an intolerance because your body doesn't make the enzymes in which to digest it. So that is the best example and most easily relatable for most of my patients. A food allergy does involve the immune system, and it's truly when an IgE antigen creates an antibody to the food and it creates this allergic reaction. So if you hear about patients with an anaphylactic allergy to peanuts or dairy or gluten, anything along those lines, that anaphylactic type of reaction is 100% going to be a food allergy. Now, there's varying degrees of that reaction. So some patients, it might take an hour, it might take 2 hours. There is a little bit of variability in the length of time as well as the severity of that reaction. And again, that just has to do with how many antibodies have they recruited to join this and what is the sensitivity level of those antibodies. Next, there's food sensitivities. So food sensitivities also involve the immune system, but they have nothing to do with IgE antibodies. Instead, your circulating white blood cells, which is often like your lymphocytes or your granulocytes, are going to react to the food or even a chemical within the food and release these pro-inflammatory chemicals that drive, then they're called mediators, and these mediators attract all kinds of cells to your body and create all of these types of inflammatory symptoms. Now, these reactions can be very delayed, and they also are incredibly dose dependent. So I might have a patient, let's just say their food sensitivity is to coconut, and they might discover that, sure, a little bit of coconut in a gluten-free product is not a big deal. But if they were to use coconut oil or they were to actually put shredded coconut into something for baking, that's when it becomes an issue, because then they're also going to eat it for multiple days. So a here and there situation might be totally fine with some of these foods versus all the time we have to avoid it. So that's a really big thing to note with food sensitivities is there often is a tolerance level. And so it's not like these foods are gone for life. You just have to figure out what works for you and what does your body respond to. So the types of food sensitivity testing that are out there, we've got the IgE, which is your traditional true food allergy, usually done with blood. You can also do some skin prick type tests. And that's your body making antibodies against the food, or maybe it's a seasonal allergy type of situation. Then we've got IgE, which is a blood test. But recent research is really showing that a positive doesn't necessarily guarantee that you're allergic to the food. They might be totally fine with it and not actually be having any type of reaction or inflammation within the body. So IgE testing isn't necessarily reliable. So in my world, the testing that I like to include is called LEAP. And LEAP stands for Lifestyle Eating and Performance. And this is an immune system test. There's no IgE antibodies that are produced, but we look at all the other cells within the body and the immune system and how are they reacting and when are they triggering these mediators, so to speak, that go into your body and create pain and inflammation and a whole host of symptoms. So why on earth should you care about food sensitivities? Well, we already know, as we've talked, it activates the immune system. When we have our immune system active, we're going to have more inflammation. Chronic inflammation is incredibly detrimental to the body and creates many secondary problems, including weight loss resistance, You have kind of a high toxic overload. You might also become really sensitive to chemicals and even chemicals not only on food, but within food, so chemical families. And then you get increased oxidative stress, which is the equivalent of human rusting. And I don't know about you, but rusting isn't high on my bucket list. So if we think a little bit more about food sensitivities, and I am a GI dietitian, and so one of the things I like to talk about is how these food sensitivities cause pain in your gut. And as we have harmful pathogens, let's say, so we already know we do stool testing, right? That's a huge part of my practice. I want to know what's in there and what's growing. Well, these pathogens that are harmful, or they might be opportunistic in that normal amounts within our gut are okay, but once they start to get too high, it becomes harmful to us. And these pathogens actually attract defense cells. And this triggers nerve pain because these cells are attracted to that visceral area where all those nerve endings are. Likewise, if histamines are attracted, histamines go through a process called degranulation. It's kind of like the cell exploding, if you will. And those are often occurring at the ends of those nerves. So again, at the nerve endings. So there's multiple ways in which the GI pathogens or their response, so maybe those histamines, are going to result in pain. So it is incredibly important. Not only do I like to look at bacteria, but I also want to understand what are the foods that might be triggering some of these reactions so that we can get you the most comfortable, get your symptom resolution as quick as possible, and then work on rebuilding not only your diet, but also your gut. Super important. So you might be wondering, who needs food sensitivity testing? So it's a pretty thorough analysis that we do, but just like to read off some of the symptoms that might make you go, aha, that's me. Maybe I do need food sensitivity testing. So fatigue, brain fog, headaches are a really big one. Mood swings, maybe you've got sinus or ear congestion, or sometimes even ear pain or a tinnitus, a runny nose, any type of rash or itchy skin, achy joints or nausea, abdominal pain, excessive gas and bloating, diarrhea, constipation, water retention, and unexplained either weight gain or weight loss. And with that, I will include weight loss resistance. That's another area that we have found this incredibly beneficial. So those are just a few of the symptoms. What about actual health conditions that are linked to food sensitivities and chronic inflammation? We've got acne, ADHD, autism, chronic fatigue syndrome, depression, eczema, fibromyalgia, GERD, IBD, interstitial cystitis, IBS, migraines, psoriasis and rheumatoid arthritis, and rosacea, all type of things. So what is the process to actually become tested with LEAP? So you'll want to see a certified LEAP therapist such as myself. And what I'll do with my patients is a very thorough initial intake evaluation. And that evaluation, I'm going to make sure that you are a candidate. I'm going to make sure that your symptoms align and I can see the possibility of some resolution of your symptoms by utilizing the LEAP protocol. It's not for the faint of heart. It does take some dedication and some commitment to make sure that you can do it. And I want to be aware of everything that you have going on, including past eating disorders or suspecting eating disorders. Those are very, very important for me to take into consideration, and we can make sure that we have a plan that really fits what you need. And then if I say yes, I do think you're a good candidate and you're willing to do it, then I'm going to have a test kit mailed to your house. And then you'll take that test kit to a specialty lab. So you can't just go to your local hospital or to a LabCorp or a Quest. They don't do it. You have to use a specialty lab. And I would give you a link to know what lab to go to. And typically then I will get the results within 7 to 10 days. And you'll have an awesome packet of information mailed to your house as well. And then we'll meet and we'll figure out how to begin your protocol. We will do some meal planning because that's incredibly important to make sure you're set up for success. And then just kind of talk about integration. So what do you have going on in life? If you're leaving on vacation in a week, then we're probably not going to start it till you get back from vacation because nobody wants to be on a restricted diet while they're vacationing and trying to have fun. So we're going to wait and save everybody some stress and allow you to have one last hurrah before we really rein things in and get the inflammation under control. So what exactly does the protocol involve? Because I speak of this elimination diet. And so what happens is your foods, it's 176 foods and chemicals that are tested, and it rates them, it gives them a score, and then it color codes that score as well. And so we really are going to choose foods that are super, super low in reactivity for you to eat those first 2 weeks. And then from there, we're going to expand. And that expansion process looks different for every single patient because your situation and your body are incredibly unique. And so I will help you develop that plan so that we can step through this process. So patients can expect a 6 to 9 month timeline in total to get through this plan and really find the food triggers that they have and see which ones eventually down the road we hope we can get in moderation. But there occasionally is a food or two that stay out of your diet for the long term. Corn is one of those for me. It causes so much inflammation. You want to talk about the gut pain that I talked about earlier? That is a real experience for me when I eat corn. And so it's out of my diet. And you know what? I've made peace with it. And then I feel so much better having done that. So how do you get started? I want you to go to my website, groundedrootnutrition.com, and schedule a GI health strategy session. There we can talk and I can get you scheduled for an initial consultation and get the process rolling. I hope you enjoyed today's show. Again, please visit my website, groundedrootnutrition.com, to learn more about how I can become a partner in your health journey, or contact me directly at hello@groundedrootnutrition.com. Have a wonderful day, and I'll see you again soon.